There are many surgical options for the treatment of obesity, and at Lap Surgery Australia we're focused on the sleeve gastrectomy, the Roux-en-Y gastric bypass, single anastomosis duodeno-ileostomy and intragastric balloons. We find that these are the most effective treatments surgically for obesity.
The gastric balloon is a procedure that involves placing a football-shaped balloon into the stomach, and this is done as a day procedure in hospital under gastroscopy. The balloon is placed via a scope down the mouth, down the esophagus and into the stomach.
The intragastric balloon should be considered a temporary option in that the balloon is only effective when it is inside the patient's stomach. The other surgical options, the sleeve gastrectomy and the Roux-en-Y gastric bypass, are surgeries that have been performed by Lap Surgery Australia many times. The sleeve gastrectomy is one of our most popular options and involves making the stomach into a tube, which restricts the amount of food that a patient can eat at a time.
Looking at the sleeve and the bypass, there are major differences between the two. The sleeve gastrectomy is a newer operation. We have data out to about 10 to 15 years now, but we do know it is safe. It basically involves removing the outer portion of the stomach, leaving a tube of stomach behind. So you're reducing your stomach volume from about 1.5 to 2 litres to about 150 to 200 mils. Your stomach will hold a lot less food and fluid, but will also empty a lot quicker. So with the gastric bypass, part of the stomach is separated from the rest, a small pouch at the top. That's connected to the lower small bowel. So then food will sit in that small stomach pouch and dribble into the small bowel. Food doesn't enter the rest of the stomach, but the rest of the stomach still sits there and still has gastric juices which flow then through the rest of the bowel and rejoin the main bowel circuit lower down. Overall, the sleeve is a less risky operation than the gastric bypass. The risks are relatively low, but they're there. But the success is higher with the bypass compared with the sleeve.
These are very powerful weight loss options, but come with a range of possible side effects and are not for every single patient.
If a patient had significant reflux disease or had bad diabetes, for example, I'd very much favour the gastric bypass to the sleeve gastrectomy, and that's a discussion to have with patients. At the end of the day, it's the patient's decision what surgery to go ahead with, but it is important that they make an informed decision.
At Lap Surgery Australia, the surgeon will do a full and thorough assessment of each patient's needs as well as their medical conditions, and this will help them decide which of the surgeries is the most appropriate option for each patient.